Pregnancy symptoms at week 5. The pregnancy symptoms you feel at 5 weeks are just the beginning of the slew of changes your body is about to go through. No need to dread the entire pregnancy based on what's happening right now. Many moms-to-be say the first trimester is the toughest, so think of it as getting the rough stuff out of the way early. In the meantime, take care of yourself and get plenty of rest, eat right and figure out ways to help yourself feel better. If you're wondering what to expect at 5 weeks pregnant, here's what's most common. Sore breasts. Morning sickness gets all the attention, but aching breasts may actually be the most common symptom at 5 weeks pregnant. Morning sickness. This bad boy is so inaccurately named. Nausea in early pregnancy can happen at any time of the day, not just morning. And unfortunately, some pregnant moms feel queasy pretty much all day. In fact, if you're 5 weeks pregnant with twins, you may be more likely to have severe morning sickness. Experiment with different strategies to find what helps you deal with the queasies best. Eating small, frequent meals is one good one. You might also try vitamin B6, ginger capsules, special nausea-reducing lozenges or lollipops and acupressure wristbands. Fatigue. At 5 weeks pregnant, it's normal to want to nap in the middle of a board meeting, a dinner date, pretty much any time. You're zapped from making a baby and there's not much you can do about it except get some extra rest, do some light exercise and eat every few hours. Frequent urination. You might notice yourself having the urge to pee more often early in pregnancy. This symptom at 5 weeks pregnant is in part because your kidneys are actually expanding. Cramps. Around 4 or 5 weeks, cramping could be a sign the embryo has implanted nicely into the lining of your uterus. Or it could be a sign your uterus is expanding and stretching your ligaments. If you're feeling cramping at 5 weeks pregnant that's severe or painful, call your doctor and get checked out to make sure it's not a sign of a problem. Spotting. When you're 5 weeks pregnant, spotting can seem scary, but a little blood on your underwear could also be a sign of implantation. You might also spot a bit after sex, since your cervix is more sensitive now that you're pregnant. This is totally normal, but if you're having something that's less like spotting and more like bleeding at 5 weeks pregnant, or really, if you're concerned at all, call the doctor. Some moms-to-be who are 5 weeks pregnant feel no symptoms at all. Or it might feel like, at 5 weeks pregnant, symptoms come and go. And all of that is totally okay. Just because you're not feeling sick or sore doesn't mean there's something wrong with the pregnancy. It just means you're lucky. What you might feel like at 5 weeks pregnant. The experience at 5 weeks pregnant can vary a lot from person to person, so it might be best not to expect anything specific, but to prepare for everything. If nothing else, you're likely to feel more tired than usual, and your body is probably just starting to feel a little wonky, but hopefully you're not in the thick of it quite yet. If your symptoms are severe, there's never any harm in calling your doctor to check in, and possibly check for multiples.